Vishnu from Chennai to present his topic on constitution, temperament and diathesis.
Very good evening to all. Senior homeopaths, my friends, dear colleagues. This topic is a little bit deviating from the other speakers. Constitution, temperament and diathesis. Otherwise, we go for the totality, simply the totality of symptom match the drug and give the medicine without knowing whether it is a logical explanation we can give for this particular case. And moreover, when the medicine fails or when we are not able to get the result and we say that what is the obstacle, then we think about the constitutional treatment. How many patients we can fix the constitution to the physical temperament? Just we cannot say that he is an axiomica, pulsate, calcarica apply. And there is plenty of information we need, that is constitution, useful to the physician in assisting him to are the particulars of the most probable exciting cause of the acute disease, as also the most significant points in the whole history of the chronic disease to enable him to discover the fundamental cause, which is generally due to a chronic miasm. In these investigations, the ascertainable physical constitution of the patient, the whole history of case taking is simplified in this aphorism number 5. And we can just go through the exciting cause of the acute disease. He explained about the acute disease. How most significant points in the whole history of the chronic disease. While treating the chronic disease, what we have to pick up the ideas, what are the informations we have to derive. He says that generally due to a chronic miasm. Simply we know that diathesis, the predisposition for the diseases and generals for the individuality. Next. And moreover, the constitution is redefined by Gravel as the oxenoid and the carbo-nitrogenoid and the nitrogenoid constitution, and moreover it is contributed with the syphilitic understanding and zoric understanding and psychotic understanding of the constitution. Next. We are altered, sensitized with a certain level. When irritated further and further, we manifest some the psychotic tendencies. Take example of some other chikungunya virus. Today it presents the CRP protein. What does it? The immunoglobulins are nothing but the message of the miasm. Later on, it produces some tendencies, indurations. Indurations is the SORA syphilitic tendency. When it proliferates, we don't know anything about the chikungunya now, but later on, after sometimes they make that venereal part they make predispose. Then we understand that it is the psychotic miasm. When it indurate and coming to the cancerous tendencies, it will be a syphilitic miasm. So each and every activity of these investigations are required for our understanding of disease. As you produce the VDRL positive and negative. And today, last clinical meeting at Chennai, they produced one RA factor, positive and negative. Even hepatitis C also, C and B. And so many things are possible with homeopathy. What it says, actually every incurable disease which is labeled in the community level are curable with homeopathy. That's what homeopathy lies and lives very happily with many physicians. Address registration like and presenting complaints and past history, family history. Family history and past history gives a lot of information about the miasm, understanding of miasm. And moreover, the physical generals and general mental generals and particulars investigation, everything, and record it properly and follow up every time when the patient comes with the ultrasonogram report, just to make a xerox and keep it in the documentation level and keep it one by one, and finally you feel better with your practice. Thank you, Dr.Balaji, for giving me